The nonprofit organization CORE, Community Organized Relief Effort, is working to help in-person schooling resume safely. Their school-based COVID testing program was successfully piloted in partnership with Friendship Public Charter School in January and February 2021. Proving that public-private collaborations work, CORE, by providing targeted technical assistance, developed a robust COVID-19 testing infrastructure model that is adaptable and scalable to fit a school's needs. Founded in 1998, the Friendship Public Charter School Network operates 8 campuses in the District of Columbia, providing instruction from pre-K-3 to 12th grade. Prior to the coronavirus pandemic, Friendship operated with 4,195 students and 899 school-based staff members. In the beginning of the 2020 school year, about 800 students and staff were allowed in the buildings while adhering to strict health and safety protocols. COVID testing was provided, conducted outside, and with limited resources.
COVID testing has been very important because there have been stigmas about how this pandemic has affected us. And we really want to ensure our students and staff that we are taking the proper safety protocols to get you back in school, ready to learn and ready to teach.
So we want to make sure that the teachers feel safe coming back in, that the students are safe coming back in, and that the parents or guardians feel safe about sending their children back into the building now.
With funding from the Rockefeller Foundation, CORE developed a station-based model creating efficient and easily replicable testing sites in multiple school buildings. At the beginning of the program, CORE assisted in developing logistics, data management, regulatory compliance, staffing, and training. By March 2021, the program became self-sufficient and run entirely by Friendship. To ensure a safe and well-maintained environment, CORE worked with each campus to develop an in-depth logistics plan, including an efficient and safe testing setup unique for each school location. Data management was another crucial area in which CORE developed several key assets for Friendship Public Charter School. Assessing the organizational IT structure, developing a data management tool tailored to schools' needs, determining the best software system to use while ensuring adherence to HIPAA and FERPA guidelines, streamlining testing registration by incorporating student and staff roster information. An easy-to-use 4-step data management system was developed. Step 1, registration. Step 2, test information. Step 3, test result reporting. Step 4, form output. And to ensure test data was correctly reported, CORE trained the authorized staff to be able to upload the test results to the local public health system. While creating the testing program, CORE ensured that local and national health and safety measures were followed at all times, and staff adhered to PPE requirements. The testing sites at each campus fell under the regulation of the Clinical Laboratory Improvement Amendments, CLIA, of 1988, which are the federal standards associated with testing people for disease. CORE assisted Friendship's health director in the application process to obtain a CLIA waiver to serve as a temporary testing site and laboratory for testing, along with support in following the required guidelines. Key to any successful program is good staffing and excellent training of that staff. During the early period of the testing program, CORE provided temporary staff for logistical and administrative support and conducted an initial 2-day training program for all testing staff, followed by further training of school staff on pre-registration and test reporting procedures.
They came in and just showed you, hey, yeah, this may be scary, but you don't have to freak out. We have protocols and policies in place to protect you with the PPE gear, what we should be doing, what we should have in the lab as far as supplies, how you should utilize the supplies, as well as how we discard the supplies.
Just a little bit.
Soon after the initial assessment and training, CORE established certified labs at each of the 8 campuses for weekly testing.
The testing is right here. It's once a week, and they get their results within 15 minutes.
A station-based model made for an efficient setup, implementation of testing, and reporting of results.
The station-based model is really good because it ensures that we are complying with just all the regulatory compliance as pertains to privacy and testing.
Station 1, which is what we call our intake station. Make sure that everybody is registered. They pre-print out barcode labels, which are used to actually identify the test sample. That student will then come in, they line up, they give their name, they get hand sanitizer, they get a basket. Station 2 is where they see the nurse. They hand that basket to the nurse, they take a seat, they swab in each nostril 5 times, they remove that swab, and then they insert it into the card, prepare it, seal it, and then that same barcode that identifies the student, that is actually placed on the outside. That basket is then passed to the staff member at the 3rd station. When the 15 minutes has elapsed, that's then where the staff member will read the test to determine whether or not it's positive, it's negative, or it's inconclusive.
The test used was the Binax Now COVID-19 antigen card, a rapid antigen test. All staff members were trained on correct test sample preparation and the interpretation process per the manufacturer's instructions. The test has 3 possible results: negative, positive, and inconclusive. A negative test result means that proteins from the virus that causes COVID-19 were not found in the sample. The test reader enters the negative test result into the data management form using a smart tablet. The school's COVID monitor will contact the child's parent or guardian or adult staff member by phone or email with their results within 12 hours of the test. A positive test result for COVID-19 indicates that antigens from SARS-CoV-2 were detected. A positive result means that the student or staff member is infected with the virus and presumed to be contagious. The staff member will get a confirmed reading by the nurse or the lab director. The person will be isolated immediately. A student with a positive result will be removed from the classroom and taken to the school's isolation room. The parent or guardian will be informed by phone and directed to come to the school immediately to pick up the child. The student is required to be tested again using a PCR test and will have to quarantine until those test results indicate they are negative or they are without symptoms based on the CDC recommended time period. An inconclusive test result indicates that no definitive result could be read. This can occur for several reasons: test card preparation error, a poor nasal swab sample was collected, or the test card was faulty. An inconclusive result requires the student or staff member to come back to the testing room for a second test. If that second test is also inconclusive, they are required to get a PCR test and quarantine until they can provide the school a clear positive or negative result. In the case of Friendship Public Charter School, reporting guidelines from the District of Columbia Department of Health required that all positive and negative cases be reported to the department's online reporting system. DC Health is responsible for all follow-up of positive cases, including contact tracing and resource coordination. During this pilot program, CORE identified key strategies for a successful implementation of a school-based testing program. Understand what assistance and methods were previously used. Have access to information before direct school engagement and planning. Develop and apply robust evaluation methods. Importantly, the station-based model was a key factor to the success of this testing program by being effective and efficient, easily replicable, requiring only 5 staff members, and minimizing the disruption time of instruction.
I'm so happy that CORE came and became a partner with us. I feel comfortable with rolling this program out in all of our campuses and making it larger because we now have the tools to help us to keep our school community safe.
The success of the program allowed for a phased approach of removing core staff and transitioning to a 100% friendship-staffed, school-based COVID-19 testing program.
There's a lot that we've applied here at Friendship that is adaptable as they get more students back into the classroom. We actually leave that community with making sure that there has been an investment, not only in the community, the landscape of the community, but the people of the community, so that they are left with tools and knowledge that will continue to carry them.
When I say it has done wonders, I'm so proud of Friendship that we are doing this. It shows that we can be a model for the nation about how we should open schools.
Everyone wants to get kids back into school. We need to get children back into the school building. So it's very important to have this type of model brought to the school so that we can get the kids back.